So we said previously that the common iliac arteries are the terminal branches of the abdominal aorta. So from this slide, you would see that the common iliac artery is the terminal branch of the abdominal aorta at the level of the fourth lumbar vertebra. At the level of the fourth lumbar vertebra, abdominal aorta becomes the common iliac artery, but we have two of them, the right and the left. So in this picture, you see your abdominal aorta. At this point, at the level of the fourth lumbar vertebra, it splits to form the left common iliac artery and the right common iliac artery. Then each of these common iliac arteries will split again to form the internal iliac artery and the external iliac artery. So one going inward internally, another one going outward, called the external iliac artery. And it is this common iliac artery that supplies the lower limb, your legs, and supplies your pelvis, the pelvic region, and the lower limbs are supplied by branches of the common iliac artery. Majorly, the internal iliac will supply all the muscles of the pelvic region and some genital organs, while the external iliac artery will continue to supply the lower limb, which is what we have here. External iliac artery supplies the lower limb, while the internal iliac artery will supply the pelvis. Good. So let's look at the internal iliac artery and its branches, or the organs that it supplies. So the internal iliac artery, as we know, is a branch of the common iliac artery. Now, this internal iliac artery has different branches, or it's supplied. We already said it will supply the pelvic region, and here you find all the organs of the pelvic region: the uterus, the vagina, the pelvic walls, the perineum, the rectum, and the anal canal, and the urinary bladder. So here you will find some of the branches of the internal iliac artery. You find the, let's start from this one. This is the anterior trunk of the internal iliac artery, which gives rise to the inferior gluteal artery. So inferior gluteal artery is going to supply the muscles that we call the gluteus muscles. So the gluteus muscles are the muscles of your buttocks. So the muscles of your buttocks are the gluteus muscles, and they are supplied by the inferior gluteal artery. Then we also have a branch here coming down here to the rectum, which we call the middle rectal artery. So that is going to supply the rectum. And then you have the internal pudendal artery, also going to supply some of the genital organs, internal pudendal artery. And then you have this branch here coming down here, which is called the inferior vesical artery, which is going to supply the urinary bladder. Inferior vesical artery is going to supply the urinary bladder. And then here you find that this internal pudendal artery continues and comes out to give rise to the dorsal artery of the penis, because I told you that the internal pudendal artery will supply the genital organs. So it continues down here to supply the penis. And then here we have the superior vesical artery, which is also supplying some parts of the urinary bladder. And then we have this umbilical artery going to supply the umbilicus. And then we have the obturator artery going to supply the obturator muscle, you know, in the pelvic region. Then we have this branch we call the medial sacral artery. But this medial sacral artery comes directly from the abdominal aorta, okay, from the abdominal aorta, not directly from the internal iliac artery, but is supplying the pelvis. So median sacral artery. So now, uterus would be supplied by uterine arteries. Uterine arteries, and those uterine arteries are branches of the internal iliac artery. But in this picture, they are not labeled in this picture. But of course, they supply the uterus. And then we'll have the vagina and the penis will be supplied by the internal pudendal artery. So you have the dorsal artery of the penis, and you have the testicular arteries that will supply testes, and the ovarian artery that will supply ovaries also. So the artery that is coming to the uterus will also supply the ovaries. And then we'll have the pelvic walls, and these muscles that form the pelvic walls is the muscle here, obturator muscle, supplied by the obturator artery. And then the perineum, also supplied by the internal pudendal artery, the rectum by the middle rectal artery, the sacrum, the bone here, which is called the sacrum, by the middle sacral artery and the muscles around that sacrum. Then the urinary bladder by the superior vesical artery. The penis by the dorsal artery of the penis. So these are the branches of the internal iliac artery. If anything happens to the internal iliac artery, all these organs will be affected. All these organs will be affected, and they might not be able to perform their normal function anymore. Okay, let's see. External iliac artery. So we said the external iliac artery is going to supply the lower limb, while the internal iliac artery supplies the pelvic region. The external goes down to supply the lower limb. So it passes deep to the inguinal ligament and becomes the femoral artery. So here, you see the common iliac artery, you see the internal iliac artery, and then you see the external iliac artery. So this external iliac artery, after passing through the inguinal ligaments around the inguinal canal, it changes and becomes the femoral artery. So once the artery passes the inguinal ligaments, it becomes the femoral artery. And this femoral artery is going to supply the femur, yeah, and the muscles of the femur. All the muscles of the femur here will be supplied by the femoral artery. Okay. Now, let's look at the arteries of the lower limb, which are branches of the external iliac artery. And they said the first one is the femoral artery. So the femoral artery is the main arterial supply to the lower limb, because all other branches, all other arteries that supply the muscles of the lower limb, they come from the femoral artery. So it enters the thigh behind the inguinal ligaments. So here you find the inguinal ligament. This is the inguinal ligament here in your thigh region. Here we have external carotid. Once it crosses behind the inguinal ligament, it becomes the femoral artery. It becomes the femoral artery. And this femoral artery here gives off a branch, which is called the deep femoral artery. This one here, deep femoral artery, or profunda femoris artery. That's where we have the profunda brachii artery in the upper limb. Here we have the profunda femoris artery. So this branch is going here. Then it lies in a sheath with the femoral vein in the anterior component. So the femoral artery runs together with the femoral vein, which you will see in the previous diagram. So here, this blue vein vessel here is the femoral vein. So this femoral vein is running alongside the femoral artery in a sheath called the femoral sheath. Now, it ends at the lower end of the femur by entering the popliteal fossa. So this femoral artery will come down here. This is the femur, this bone here. So at the lower end of the femur, this artery will enter the fossa called the popliteal fossa. Remember, in the upper limb, we had the cubital fossa anterior to the elbow joints. But here in the lower limb, this is the knee joint. Behind the knee joint, we have a fossa called the popliteal fossa. So the femoral artery enters into that popliteal fossa and then changes its name and becomes what we call the popliteal artery. Becomes the popliteal artery. Now, the popliteal artery is deeply placed in the popliteal fossa. It divides into anterior and posterior tibial arteries. So the popliteal fossa will split to form an anterior tibial artery, this one coming this way, anterior tibial artery, and a posterior tibial artery, both coming from the popliteal artery. So remember that. You know that in the upper limb, we said that once the brachial artery crosses the cubital fossa, it would split to form radial and ulnar artery. But here, when the femoral artery enters the popliteal fossa, it becomes popliteal artery, and the popliteal artery now splits to form the anterior tibia and the posterior tibial artery. Now, the anterior tibial artery is the smallest terminal branch. It continues to the dorsum of the foot as the Dorsaliis Pedis artery. So this anterior tibial artery will come down here to form what we call the Dorsaliis Pedis artery. This one here, Dorsaliis Pedis. At your ankle, you have the Dorsaliis Pedis artery here. This is a very important artery because you can check your blood, the pulse, your blood pulse at this Dorsaliis Pedis artery. When you start doing clinical courses and you go to the hospital, your doctor is going to ask you to check the blood pressure of the patient by identifying the Dorsaliis Pedis artery and feeling the pulse. You're going to do that in the hospital with any patient. So this is the Dorsaliis Pedis artery, which is a continuation of the anterior tibial artery. Anterior tibial artery from the Dorsaliis Pedis. Then we have the posterior tibial artery. So the posterior tibial artery is this one here. So it terminates by dividing into medial and lateral plantar artery to supply the sole of the foot. So this one comes here and forms lateral plantar artery and medial plantar artery. And this lateral and medial plantar artery now form a dorsal arch here and a plantar arch, just like we had the superficial palmar arch and the deep palmar arch in the upper limb. Here we have the dorsal arch and the plantar arch formed by the medial plantar arteries and the lateral plantar arteries, which are branches of the posterior tibial artery, while the anterior tibial artery from the Dorsaliis Pedis artery. Okay, good. So, sites of arterial pulsation. Before we look at sites of arterial pulsation, if they ask you in an exam, for example, which artery supplies the biceps femoris muscle, which vessel supplies the biceps femoris muscle? So what will you say?
The femoral artery.
The femoral artery, okay. So if they say which vessel supplies the gastrocnemius muscle? Do you know what the gastrocnemius muscle is?
Also.
Okay. So that thick muscle on your leg, behind your leg, that thick muscle behind your leg. So just below your knee joints, you move downward, there's a thick muscle there behind your leg. So there you have your gastrocnemius muscle. So what do you think? Which blood vessel do you think would supply the gastrocnemius muscle?
And the popliteal artery.
Okay. So the branches of the popliteal artery. Branches of the popliteal artery. Good. So this is very important because if you already did anatomy of the muscles of the lower limb, now you know which blood vessels supply which muscle, depending on the location of the muscle. So if the muscle is in the femur, then the likelihood that to be supplied by the femoral artery or branches of the femoral artery. If it's, in between the tibia and the fibula, there is a chance that it will be supplied by either the popliteal artery or branches of the popliteal artery. Okay, if the muscle is in the foot, there's a chance that it will be supplied by the Dorsaliis Pedis or by the medial plantar and lateral plantar artery. So that is how you know which artery supplies which muscle of the body, depending on the location of the muscle. Okay. Good. So let's see site of arterial pulsation. So where can you feel the pulse of your blood? When your heart pumps the blood into different parts of the body, you should be able to know if this person's heart is still working or not by checking for pulse. When you cannot find the pulse, it shows that either the heart is not working properly or the heart is working, but a blood vessel has been blocked. There is an occlusion of a blood vessel. For example, if I come to check the Dorsaliis pulse at this Dorsaliis Pedis and I can't feel anything, I can't feel blood passing through, I can't feel the pulse, it shows me that there is either a problem with anterior tibia or posterior tibial artery, or there's a problem with femoral artery. So that's what it means. So if I check and I find the pulse, it means that, okay, these arteries are okay, there's no problem with these arteries. So now let's go to the site of pulsation. So you can take pulse at the superficial temporal artery in front of the ear. If you put your hand in front of your ears, you can feel the pulse. You can feel the pumping as if blood is pumping through. So you can feel the pulse there. So that there you have your superficial temporal artery there. So there you can feel a pulse. Then you can also feel a pulse from the facial artery at the lower border of the mandible. So at the lower border of the mandible, you see your facial artery coming here. You can feel a pulse there also at the lower border of the mandible. But that artery will be your facial artery. Here you see your superficial temporal artery where you can take pulse. And then we'll have the carotid artery. So you can take your carotid pulse at the upper border of the thyroid cartilage, at the upper border of the thyroid cartilage. So that is in the neck region. There you can take your pulse because your carotid artery, we said, is coming from the common carotid, the common carotid artery, which is coming from the aortic arch or from the brachiocephalic trunk, depending on which side. So there you can feel the pulse on the neck region. You see the common carotid artery going upward, running alongside the jugular vein. So you can get to your internal jugular vein. You can find your pulse there also. Then the subclavian artery, as it crosses the first rib. So around the first rib, the subclavian artery, we said, will cross and become the axillary artery. You can find your pulse from the subclavian artery close to the first rib. Then also you have the radial artery in front of the distal end of the radius. So now in your hand, if you check the distal end of the radius, you'll be able to feel your pulse there. Then your femoral artery, midway between the anterior superior iliac spine and the pubic symphysis. There, you can take a pulse of your femoral artery. Then you can also take pulse from the popliteal artery in the depths of the popliteal fossa. So if you press the popliteal fossa below your knee, you'll be able to feel the pulse of the blood passing through the popliteal fossa and the popliteal artery. Then the Dorsaliis Pedis in front of the ankle between the two malleoli. There also you can find blood pulse. Okay, so main site of anastomosis. So anastomosis, as we said, is a network of blood where blood comes together, different blood vessels come together, to give the kind of collateral blood supply. So where do you find anastomosis of blood vessels? Now in the upper limb, you have the scapular anastomosis. So from this diagram here, you can see this is the scapula here. This is the scapula. Now, and this is the spine of the scapula. Here in this scapula, you see a network of blood vessels, different arteries, they are coming together. Now, this anastomosis is formed between branches of the subclavian artery and branches of the axillary artery. So you see this branch coming here, like this, is coming from the subclavian artery. But we said after it crosses the first rib, it becomes the axillary artery. So you see the axillary artery giving off some branches here. So some branches come from the axillary artery and some branches coming from the subclavian artery. They both form a network of blood here, which is called anastomosis. So this is called the scapular anastomosis. Then again, we have another anastomosis around the elbow joints. Now this anastomosis is formed between branches of the brachial artery, the radial artery, and the ulnar artery. So here, this is the brachial artery. Now this branch, called superior ulnar collateral artery, Then we have the inferior ulnar collateral artery coming from the brachial artery. Then we also have here now, we have the radial and the ulnar artery. So they give up branches. So we'll have an ulnar recurrent artery going upward. And we have anterior ulnar and recurrent and posterior ulnar recurrent. So they come and form an anastomosis around this elbow joints. So some vessels coming from the brachial artery, some vessels coming from the ulnar artery, and some vessels coming from the radial artery, the ulnar recurrence going upward. So they form the network of blood around the elbow joint. So this is called the elbow anastomosis. Now I'm going to give you like an assignment to list all the blood vessels that form the elbow anastomosis. List all the blood vessels that form the elbow anastomosis. I already said that there are branches of the brachial artery, the radial artery, and the ulnar artery, but list the specific names. Okay, so we have the inferior ulnar collateral, superior ulnar collateral, and then we have the ulnar recurrent arteries. So they form the anastomosis. Good. Now, in the lower limb, we have the trochanteric and cruciate anastomosis between the branches of the internal iliac and the femoral artery. Between the branches of the internal iliac and the femoral artery. So here you have the femoral artery. It gives off these branches. And then some branches from the internal iliac, they join together here to form an anastomosis called the trochanteric and the cruciate anastomosis. Okay, some branches from the femoral artery and some branches from the internal iliac artery. They form that anastomosis around the hip joint. So the artery that make up that anastomosis, they have the medial femoral circumflex artery, the lateral femoral circumflex artery, and then you have the profunda brachial artery, you have the inferior gluteal artery, superior gluteal artery, which are coming from the internal iliac artery. They join the branches of the femoral artery to form this anastomosis or this network of blood here. So that is all about blood supply to the body. So all blood vessels that come or originated from the heart eventually get to all the organs of the body, and no body organ is deprived of blood supply. All body organs are well supplied with arterial blood, beginning from the aorta upward to the brain, downward to the feet. All organs and all muscles receive blood supply, arterial blood supply. And we already said that that blood contains oxygen and nutrients. So that is what is being supplied to all the organs of the body. So in our next class, we would look at the venous drainage. Since we've already talked about the arterial supply to all organs, we'll look at the venous drainage. And in our next class, we're going to take a quiz about the arterial circulation involving all arteries. Okay, good. Do you have any question?
Yes, sir.
Okay, good. So if there's no question, that will be all. Thank you so much, and see you soon.
Thank you, sir.